Hello, my name is Siti Amirah Hakimah binti Fairuz. Today we are going to talk about Levodopa. So the reason why I choose Levodopa as anti-Parkinson disease treatment, the reason for this is Levodopa is the most effective medication to treat motor symptom of Parkinson. Of course, there are other many classes as well that can treat the motor symptom of Parkinson, but Levodopa is the most effective one. Because to add that reason, eventually all patients with Parkinson will add levodopa to their medication regimen. So for some individuals that are started on levodopa, but some other individual they won't be adding levodopa to their regimen until later in the disease. And I think an important thing with levodopa is our response to levodopa changes as Parkinson progresses. So it's just really important to know how it works and the best way to take it just to ensure that you will get the most out of your levodopa therapy. So I will show you what I meant as we go through the section and explanation. So levodopa is the gold standard. Like I said before, it is the most effective medication to treat the motor symptom of Parkinson. So often people find that levodopa is really good for you, for your bradykinesia, which is the slow movements. So it will help you by getting ready in the morning. All include changing your clothes, bath, eating, going to do some errands, and the things that you need to do for your day-to-day routine. So they will find that levodopa helps with that. Bradykinesia. It will also help in the rigidity and the stiffness that you may feel as well. So the one thing that people will find levodopa may or may not help in this treatment is the tremor symptom. So levodopa are more resistant kind of medication resistant symptoms. So some people we find that even when they do possible, when they try to increase their levodopa dose to help manage the tremor, they won't experience any improvement at all. So in cases where people try to increase their levodopa dose to treat the symptom, they find that they might get more dyskinesias or side effect during their levodopa therapy. So it is better for you, which is the patient, to talk to your neurologist about it. If it's getting to the point where your tremor might be debilitating or just really affecting your quality of life. So take note that levodopa won't help with postural instability, any balance problems. The best thing for that, of course, is exercise. It is more preferable for you if you do exercise. For example, you can try bike riding, swimming, doing Tai Chi or yoga. So exercise is definitely help with balance problems, whereas the medication, which is the levodopa, really helps allowing you to continually moving and allow you to make sure that you are getting the most out of your exercise because you are fully on and fully can engage in those activities which include your day-to-day movement and activity. So next, how long it's going to take to start working, or we call it as onset of action of levodopa. For immediate release, approximately 30 minutes, while control release, approximately 1 to 2 hours. So bear in mind, it depends with individual. So for some people, they do really well with control release, but for some people, they might find that the absorption is a little more erratic for control release. For administration method, in immediate release, try tablet taking the first thing in the morning before you brush your teeth or bath. So try to prepare levodopa medication next to your bed and a cup of water. This is because immediate release have 30 minutes onset. If you take the first thing in the morning while you bath or get ready for the day, you're already starting to feel on and ready to go. So in the sense, your medication has kicked in. So in addition, You might waking up in the middle of the night and it's taking a bit longer for you or for patient to fall back asleep if you waking up in the middle of the night. So it is recommend that you don't reach for your control release tablet, reach for your immediate release tablet. And if you can, just chew it and take it with any carbonated beverages to help speed up the onset of action so you can get back to sleep sooner. So for control release, yes, control release may be used at bedtime to help managing the symptoms during the middle of night. It can really help manage you through the night all the way to the morning. So how to take levodopa? It should best take on empty stomach, and as by taking on empty stomach, it can help increase absorption. So you should take 30 to 60 minutes before meal and 1 to 2 hours after meals. So the main thing though is that if you taking levodopa, in addition taking it on empty stomach, you want to make sure that you space it from iron, because iron can decrease the amount of absorption of levodopa. In addition, you should spacing it from protein as well, because protein-rich food may block levodopa absorption. Thus, it will also decrease its effectiveness. And this is because when you take protein-rich food at the same time you take your levodopa medication, it will compete with each other. So spacing is important. So next, the side effect of levodopa. Some people experience with nausea when they first start on levodopa therapy. In cases where they are experienced with that, I recommend something with no protein, so maybe crackers, a slice of toast, half a banana, or a small piece of fruit to overcome nausea. So generally with nausea, it does go away after a couple of weeks, maybe a few weeks or so. So that will be the strategy to overcome it. Other than that, vomiting and orthostatic hypotension will be possible for you to experience. So orthostatic hypotension is lightheadedness when standing up from sitting or lying down position. So you're just getting up slow while your body adjusts to the medication. Other than that, side effect you may experience are confusion, hallucination, and motor complication that include motor fluctuation and bradykinesia. So before your next appointment, it is recommended for you to see what you can do your best with your current levodopa regimen and optimize your management and manage your Parkinson's symptom as well. You should take on empty stomach 30 to 60 minutes before meal, 1 to 2 hours after meals, and you should space it with iron and protein intake to make sure you get the most out of your medication. So that's all from me. Thank you.